Hi, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Today we're going to talk about the Consumer Financial Protection Bureau, but before we do, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, which is the text for today's speech, and actions and stories and analyses and studies. All those links are in that newsletter. Of course, you can subscribe to that newsletter for free, and then these will be delivered to your inbox every day. So let's talk. The Consumer Financial Protection Bureau was established in 2010 after the 2008 financial meltdown that took ordinary citizens to the cleaners. Since then, the CFPB has done its share of policing mortgage brokers, student loan companies, and banks. But as the U.S. healthcare system turns tens of millions of Americans into debtors, this financial watchdog is increasingly working to protect beleaguered patients, adding hospitals, nursing homes, and patient financing companies to the list of institutions that regulators are probing. I want to point out this story ran at National Public Radio, and there's a link to the broadcast in the newsletter. In its most ambitious move to date, the agency is developing rules that will bar medical debt from consumer credit reports. This is a sweeping change that could make it easier for Americans burdened by medical debt to rent a home, buy a car, or even get a job. Those rules are expected to be unveiled later this year. I'm going to point to something out. This is a promise that is fulfilled by President Biden. At the same time, the U.S. Supreme Court is considering a broader legal challenge to the agency's funding that, of course, some conservative critics and the financial industry, their officials, hope will lead to the dissolution of the agency entirely. This seems to be a Republican tack on an agency designed to protect us from financial predators. I sincerely hope this fails. But CFPB's defenders say its move to address medical debt simply reflects the scale of a crisis that now touches about 100 million Americans, and that a divided Congress is just unlikely to address anytime in the near future. CFPB researchers documented that unpaid medical bills are historically the most common form of debt on consumers' credit reports, representing more than half of all debts on those reports. But the agency found that medical debt is a poor predictor of whether somebody is likely to pay off all their other bills and loans. That's the important part. There are other actions the agency has taken to protect consumers, and those include warning nursing homes against forcing residents' friends and family to assume responsibility for residents' debt. An investigation by the Kaiser Family Foundation for Health News and NPR documented widespread use of lawsuits by nursing homes in communities to pursue friends and relatives of nursing home residents. The CFPB has also highlighted problems with how hospitals provide financial assistance to low-income patients. Regulators last year flagged the dangers of loans and credit cards that healthcare providers push onto patients, saddling them with more debt. So the provider gets paid right away, and you essentially ruin the credit of someone who has that credit card, and it doesn't easily show up as medical debt because it's on a credit card. It's just a stinko move. Anyway, the CFPB can't do much about the price of a prescription or a hospital bill, the director Rohit Chopra said, but what the federal agency can do is protect patients if they can't pay their bills. So here's the deal. Keep in mind, medical bills don't really have an effect on what your credit score should be. And that's what they're going to do. They're going to take medical bills out of the credit score equation. Good move. So what can we do? Well, here's a quick action that's sort of a nice thing to do. We can thank the director of the Consumer Financial Protection Bureau, Director Rohit Chopra, for advocating for patients and protecting us from healthcare predators. His email, I'll put it in the link, is rohit.chopra@cfpb.gov, and I also will have a link in there. If you click on the link, it'll automatically just send an email to him saying, thanks for doing a good job for all of us. Okay, that's what I've got for you today. Down below, you can like, share, and subscribe. You can also subscribe for free to the Healthcare Advocacy newsletter. Put in the comment area any subject you'd like investigated or comments on the videos, or you can send them to me at healthcareadvocacy1@gmail.com. Thanks and have a good evening.